Today we welcome Dr. Jelena Rascon. She's the head of the Hematopoietic Stem Cell Transplantation Department at the Oncohematology Center at Vilnius University Children's Hospital. So, Dr. Jelena Rascon, thank you very much for accepting the invitation for the interview. And well, do you want to explain us which has been the government lockdown policy in Lithuania?
Actually, in Lithuania, the lockdown policy, the first restrictions, they were announced, I think, on March 10 or March 11. At that time, we had only one confirmed case in the country, but it was locked down immediately. Actually, most of us probably were too skeptic. So why such a strong, strict measures when we have only one case and so on? But I think really it was probably a good decision, a right decision. Because it prevented the spread of the disease. Of course, it occurred anyway, but probably we could avoid this burnout of the healthcare system. Because actually, at the beginning of the spread of the disease, the quarantine, this lockdown time, it was announced on March 16 already. So it was very few, like a transition period. So actually all the strict restrictions, they came on March 16th. And since March 16, the country was really locked down. And all at the beginning, the cases were exclusively imported with the people who came back to Lithuania and who brought the coronavirus. And subsequently, of course, the next phase, it was the internal spread of the disease. But actually, I think we had some flights until the beginning of April, because there were special flights with the people that were brought from several countries who wanted to come back to Lithuania. And but they were not regular flight, but mostly organized by the Ministry of External Affairs. So that was the policy. But of course, we had to stay at home, wearing masks. There were restrictions. People who could work at home, they were encouraged very much to stay at home. The schools also were suspended. I mean, the measures like in all the Europe. But I mean, probably relatively it was introduced quite early.
How has the general hospital activity changed to adjust to this pandemic, and what about the pediatric activity?
All planned and not emergency healthcare services, they were cancelled. And of course, we had a decrease in number of patients. I mean, this did not, let's say, affect our pediatric oncology or transplant service. Actually, fortunately, at this moment, we did not have any urgent transplantation except the one of one mom who was the patient was started to already. The conditioning was already started when all the flights were cancelled. So there was we had one pediatric patient and two patients in adults who were in the same situation, and we had to take some extra measures to bring stem cells to this patient. So even this military planes machines, they were like, how to say, they were sent for the cells. I mean, this the army, they collaborated very much in this. So, but I mean, for example, the number of emergency visits to the hospital, at least in pediatrics, they decreased substantially because there were all contacts and all potential contamination way, like playgrounds or common activities, they were locked down. And also strict requirements for hygiene, this hand washing, and it was, you know, it was, I think, a chance for people to learn how to procure the hygiene requirements, and we did see this decrease in emergency visits. So, but I mean, this health services that could impair the patient's condition with serious like chemotherapy or transfusion service, they were maintained, of course.
How have you managed the outpatients visits for pediatric transplant children during these weeks?
Yes, actually, we used the telemedicine, this remote counseling. The patient were calling and they were explaining. I mean, for example, if the patient had to got another prescription of any kind of medicine, it was prescribed using telemedicine or using remote control. I don't know, probably this is already the reality in all countries. So we use electronic prescriptions, and patient can, it goes automatically to e-health system that is countrywide, and so the patient, they just need to go to the pharmacy to pick their medicine up. So that was the reality.
In your opinion, what are the main issues that may arise in the short term due to this situation, both in transplanted children or children waiting for a transplantation?
You know, probably our major concern now, as this lockdown policy, it's released almost completely now in the country, so there are movement on people, and there are no more restrictions. The restrictions, they still are. For example, we still have to wear masks in these public cities, in supermarkets, or when we contact each other, whenever the people are. The people are not obliged to wear masks when they are outside, let's say, when there are no close contact between. So the major concern is probably that people are now more relaxed. They do not, there are more social contacts. There are more, let's say, live meetings and so on. So we are afraid that probably there will be some cases that people or patients or the guardians of children, they probably can be like a transmitter of the infection without knowing it, you know, the asymptomatic cases. So this is the, for example, one of the concern, how to open outpatient services and how make them functioning without compromising safety of patients and of course of the personnel, to avoid the contamination. To avoid contamination of the personnel, you know, so this is the concern. Actually, the waiting list in our situation, we are a small country, and there is no big number of transplants. So at least in our situation, there will be no problem to perform a transplantation as it was scheduled. You know, so this is the concern. So I don't expect the problems like a delay in transplantation or similar ones, but mostly I'm afraid about this unconscious transmission of the infection.
So thank you very much, Jelena.